about chronic pain, which is a very difficult situation. My name is Dulcie. I'm a therapist here in town, a counselor. I specialize in hypnotherapy, and my greatest joy is working with folks toward their health and their inner healing. And after all these years, it's still my greatest joy. So we are the Healing Collective of Western Colorado, and our fearless leader is Erin at the end there. We're a not-for-profit organization, and we provide education on complementary healing and wellness options to the local community, which is you guys. We do it through expos, classes, demonstrations, and speaking events. This is our first speaking event of the year, so we're really glad you're kicking us off. Thank you. We also provide continued education on alternative healing to business and business ownership, to local healers and wellness providers. What we all believe, that our collective, is that we believe in the healing power of community. It's very important. And we know that for true healing to happen, we must do it together. And we also know that healing is not a one-size-fits-all. It's an individual thing, and each individual picks their healing team. They pick their wide array of support. And so our purpose as the Healing Collective of Western Colorado is to introduce as many people as possible to as many healing options as possible so that they can build the path that's right for them. There's no need for us to be stuck in this chronic pain. And did you know in 2021, 21% of the US population suffered from chronic pain? That's in 2021. That's 21%. Of course, it has negative effects on daily life, daily work. It's been linked to depression, Alzheimer's, and related dementias, higher suicide risk, and substance use and abuse. And that came from a study by a fellow by the name of Rickett in 2021. Chronic pain is highly persistent. In other words, it keeps at you. With 61% who reported chronic pain was still reporting chronic pain the following year. So the failure to manage chronic pain, as well as the opioid dependence associated with it, can result in death and absolute misery. Research has shown the lifetime prevalence for chronic pain patients attempting suicide between 5 and 14%, with suicidal ideation at 20%. Oh my goodness, guys, all these statistics are just miserable, and they're high. And of the chronic pain patients who commit suicide, over 16% do it via opioid overdose. And a lot of these stats came from Bree, who shared them with Erin, who wrote this little piece about chronic pain. And we can see that individuals who suffer from chronic pain, they need a lot of support, and support that addresses more than just their physical body, which is why we, the Healing Collective of Western Colorado, are dedicated to helping them build a healing team to take care of the whole being. And so we have these 5 fabulous folks here today, well-educated, lots of experience, and they come from different fields. And I do so hope that you have signed your name on a little piece of paper and put it in the jar over there. If you haven't, stick your hand up, and Sarah will come over, and because these folks have offered some of their services for no charge, or for greatly discounted. These are the booths, the tables. Each practitioner has a table with their information on it. And then this is the one for all of us, and you can find all of our business cards here. So, without, yes, please.
We're only 5 people of the Healing Collective, which is composed of quite a few different people, many of whom have their cards over here.
Thank you, James. And we're going to be doing these lectures throughout the next year. We've got one on stress coming up in January. So if you want to get on our email list, can they put it on your one over there, Erin?
Yeah.
On Erin's table, the one that says the mindful body, there's a list there if you'd like to get on it, and we'll keep you appraised of our next lecture. So I'm going to introduce each person one at a time, and they will have 12 minutes to speak, and then I'll introduce the next one. So without further ado, we have the lovely Dr. Melinda Marzolf. Is that how you pronounce it? Melinda joined Peak Family Medicine in 2021 as a primary care physician and assistant medical director. Her medical focus has evolved from geriatric to traditional primary care, along with prevention and lifestyle medicine. Her previous primary care experience includes Iora Primary Care in Colorado Permanente Medical Group in Aurora, Lutheran Senior Life Heritage Valley Health System in Beaver, Pennsylvania. Melinda earned her medical doctorate from the Philadelphia College of Osteopathic Medicine, and her undergraduate degree is at Susquehanna University. I hope I pronounced all of that correctly. Thank you, Melinda.
Thank you. All right. I'm going to try standing. And if anyone can't hear me, please let me know, and I'll attempt to adjust. So, as Dulce said, I'm Melinda Marzolf. I'm a primary care physician, and I think I'm going to speak sort of first to just kind of talk a little bit about chronic pain, and then how, as a primary care physician, I approach that, and how my field typically approaches that. So. As we mentioned, chronic pain is pretty significant. I think it's a fair amount of my practice. My patients are either coming with pain and often have already exhausted a whole lot of possibilities and have lost, sort of that feeling of hope. And my job is to try to figure out kind of where that pain's coming from and then the different ways in which we can attack it. Typically, how I approach is, acute pain is somewhat easy. You go to lift up a heavy box and you hurt your back and you go, my back hurts. You rest, it gets better, and life moves on. And that's appropriate. The body tells you something is hurt, and you respond by saying, I'm going to stop doing that. And so then it allows your body that time to heal and recover. In chronic pain, that stimulus, that lifting that, doesn't necessarily go away. That pathway continues. And with that pathway, our traditional acute pain management, like using anti-inflammatories, medications like Tylenol, opiates, muscle relaxants, those don't work very well because it's not for the body to necessarily have that injury recover as much as it is that there's a whole cascade of pathways that happen. Our body adapts to that pain response. Our pain receptors become more sensitive and continue to send the stimulus even though that box is no longer in our arms. Our central nervous system within our spine also starts to upregulate, so pain feels even more intense, and that pathway feeds off of itself. So often patients who come to see me feel like, us as providers feel like, well, you just think it's in my head and that there's not a problem. But it is in your spine. It is the neurologic system that is involved there. And as traditional medical practice don't always have the best modalities, again, we throw things at it. And I feel as a profession very responsible for not treating chronic pain very well. With that being said, I think we've advanced. We've gotten better over the years. We've realized that there are these different receptors that are happening. There's neuropathic pain. There's visceral pain coming from our organs. There's pain stimulus that's coming from nerve damage. There's pain coming from the musculoskeletal system. And so as I look at a patient who's coming, I try to figure out what started it, why is it still continuing, and then what can we do about it? So with neuropathic pain, which is one of the more difficult parts to treat with a traditional medical approach, we'll use different medications like duloxetine or Cymbalta is one that used to be on TV all the time. But what it does is it helps affect those neurotransmitters within the nerves that then help to mediate that pain cycle. Because that stimulus is gone, we don't need to feel that pain anymore. We've stopped doing what caused that pain. So that's one way as far as using medications for it. For inflammation and related to like a bursitis and the shoulder that, shoulders take an enormous amount of time to recover from. You get a lot of inflammation from that. We have medications that help reduce that inflammation that we think also reduces that long chronic pain pathway. Other approaches that we'll take are being able to add in some of the other modalities. Some of them are sitting at the table today. And I feel very privileged as a practitioner that I can perform some of those types of modalities like manipulation, but I also have a huge resource within the community as far as people that I can send to, because it is very personalized. Other factors that I particularly look at are, how is it impacting you? What functional things have now changed that you can't do because of your pain? That becomes the focus versus necessarily pain's got to be gone, but we've got to be able to make it manageable and function, because we know when you can function better, that's going to help the pain regulation improve better. Some of that's through exercise, some of that's through physical therapy to be able to help strengthen the body, to be able to help reduce injury, which also helps with improving inflammation, improving just kind of quality of life, using muscles that are going to take the pressure off of other muscles that have been hurting. Also looking at how chronic pain is affecting us emotionally. I think that's the biggest thing that we miss, because the perception is that we don't think it's real. But it's really how it ends up. It's the same chemicals, the same neurotransmitters that affect depression also affect pain. And so being able to tackle that aspect of things along with the pain end up being able to cumulatively do so much more. And so I'll often talk about, how has this impacted you? How's this affecting your relationships? How is this, affecting your sleep? Sleep is so restorative. And when that's disturbed by pain, again, it starts that pathway that's kind of gone rogue, it keeps it rogue. And so being able to then find those little things that we can do to be able to make that pain, again, more manageable. Other aspects that I think are really important that are, again, underplayed in my profession, but has become a passion of mine, is diet. Our diet is very inflammatory. And if you think your threshold's already up as far as your pain, and then you add in more inflammation from our diet, it's just going to explode. And I think that's part of why we're in the crisis that we're in, is because so much of our diet affects that. We often use food to medicate ourselves. We use food to make ourselves feel better, and those foods often end up contributing to the inflammation. So being really conscious of that and looking at just the whole package as far as what's going on for that specific patient, and then looking at the different things like massage therapy, acupuncture, mindfulness, therapy sessions, chiropractic, osteopathic manipulation, and saying which of these are going to fit into your world that are going to help make your pain better. So I'm not always the one fixing it. I don't get to, unfortunately, do that enough. But helping to be a partner and a coach alongside the patient to be able to come up with a plan that's going to help work for them specifically. Yeah.